Hi everyone, thank you for coming despite the sunny weather. I'm going to be talking about factors that are associated with perceived stigma and bullying of orphans in Zambia. And I'd just like to give a quick thank you to our funders without whom this wouldn't have been possible, and the research team who collected the data. So, as a bit of a background, according to UNICEF, there are 55,000 orphans in sub-Saharan Africa, and of these, 15,000 have been orphaned due to HIV and AIDS. These youth face a multitude of adversities, many of which can also be stigmatizing. And among those are familial HIV and AIDS, widespread and often severe poverty, and high morbidity. So in turn, both stigma and bullying victimization have been associated with adverse mental health outcomes that are often long-lasting. We have longitudinal evidence that shows that over 4 years, stigma is associated with persistent higher depressive symptoms and higher anxiety symptoms. Bullying also is associated with these outcomes, as well as post-traumatic stress, externalizing problems, so conduct problems, and we have analytical evidence showing over a twofold higher likelihood of suicide ideation and suicide attempts among kids who have been bullied versus those who haven't. But very little is known about what factors actually stigmatize orphaned youth. And existing research identifies AIDS-related orphanhood as opposed to other types of orphanhood as a key stigmatizing marker. And when I say markers, I'm using Goffman's definition of a visible or diagnostic trait that can be used to kind of differentiate the stigmatized from the stigmatizers. But when we have information about AIDS-related orphanhood being a predictor, this gives us very limited programmatic implications, especially for the youth who have already been orphaned. And so we wanted to see what were the other markers, because we know that these interventions to counter stigma and bullying must be sensitive to the needs of orphans. So we looked at 3 stigma markers and wanted to see how they were associated with 2 outcomes: perceived stigma and bullying victimization in a sample of Zambian orphans. We looked at AIDS-related orphanhood versus orphanhood due to other causes, poverty, and morbidity. And I've highlighted AIDS-related orphanhood as red and the others are green because AIDS-related orphanhood is not modifiable and poverty and child health are. Our method was a cross-sectional survey of over 900 kids in rural communities in Zambia. The data was collected by the Swiss Academy for Development. We used purposive sampling, so in fact, total population sampling of orphaned adolescents within the study sites. And this gave us a total of 484 orphaned adolescents. And our participants were aged 10 to 18. Ethics approval was obtained from the University of Zambia, and questionnaires were completed through same-sex face-to-face interviews. So these are the measures that we used. We used the brief stigma by association scale that was only later validated in a sample of orphaned and vulnerable youth in South Africa. And this scale measures stigma by association to the ill or deceased parent in a household. Bullying victimization was measured through the adapted multidimensional peer victimization scale. Food insecurity as an indicator of poverty was measured following earlier studies with vulnerable youth in sub-Saharan Africa as the number of days in the past week that the child has gone hungry. Physical health was measured as past month frequency of somatic complaints, and the somatic complaints were informed by a qualitative pre-study. And AIDS-related orphanhood was determined through verbal autopsy, which is a symptom checklist, and I'm happy to answer questions about it afterwards. So within our sample of orphans, 15% had lost a parent due to HIV or AIDS. And the rest of the descriptives really show us that these kids are not doing well, the overall orphan sample. A quarter of them reported having gone hungry for 2 or more days in the past week. 56% reported 3 or more somatic complaints in the past month. 70% reported any perceived stigma, so that's a positive response to any of the items, and 89% reported any bullying victimization. Our multiple linear regression controlled for age and gender, and our findings were kind of consistent with respect to both outcomes, both perceived stigma and bullying. We found that AIDS-related orphanhood compared to other types of orphanhood was not predictive of either outcome. So it did not predict perceived stigma and it did not predict bullying victimization. But poor health and food insecurity were both predictors of perceived stigma and bullying victimization. Together, poor health and poverty accounted for 10% of the variation in perceived stigma and 9% of the variation in bullying victimization among orphans. So then we compared the mean scores of stigma and bullying between 2 different types of orphans. We compare a healthy and well-fed child to an unhealthy and hungry child. And we see a double increase in stigma scores and bullying victimization. So in sum, AIDS-related orphanhood, when compared to other types of orphanhood, was not associated with either stigma or bullying victimization in our sample. But extreme poverty and morbidity were both associated with both stigma and bullying of orphans. I want to highlight that our finding with regards to AIDS-related orphanhood was inconsistent with existing research that's coming out from sub-Saharan Africa and utilizes larger samples. So I would be very cautious in drawing firm inferences from this. But what the data do tell us is that poverty and poor health of orphans are definitely very important factors. And this really highlights the potential for poverty alleviation and health promotion programs, and in particular, whole school approaches might be helpful. And I'd like to end on an encouraging note, because we might not be able to change parental cause of death, but we can definitely affect child poverty and health.
Thanks, Ms. Maria, for the nice presentation.